State of Affairs is pleased to welcome Carole Johnson, the Commissioner of the New Jersey Department of Human Services. Good to see you, Commissioner.
Thank you. Thanks so much for having me.
Make it clear what you're responsible for. It's a huge department.
Yes, I'm really honored to be the Commissioner of the Department of Human Services under Governor Murphy. We run the state's Medicaid program that provides health care coverage to 1.7 million New Jerseyans. We provide food assistance to 700,000 New Jerseyans through our SNAP program. We're the Childcare agency. We're the aging agency. We're the agency for individuals with intellectual and developmental disabilities. We're the mental health and substance use disorder agency. So we have a wide range of
It's a huge
services.
portfolio. Commissioner, do this because you mentioned childcare. You were with us early on in the Murphy administration, and we talked about an initiative you're about to see on camera right now, our initiative called Right from the Start NJ, focusing on improving the childcare situation and other related issues for infants and toddlers. We talked about it at the beginning. You are with us now. Since then, just recently, there's a $54 million in additional funding that's going toward what as it relates to childcare? And how does that relate to this initiative?
Well, thank you. Thank you for the work that you've done on Right from the Start and
With
for
a lot of partners and
all the
teammates.
partners across the state. That work and our partners across the state and advocates across the state have been part of our shared goal of saying that what we need to do is to invest in quality, affordable childcare. And it's very rare that you have a policy issue that's really a twofer. And in this instance, investing in good quality childcare is a twofer because the science tells us all about brain development. We need to have quality childcare and services for children, but the economics tell us good quality childcare are what's going to help families feel safe and comfortable and be in the workforce. And so too many women are not in the workforce because they don't have confidence in quality
So this
affordable
$54
childcare.
million goes to?
$54 million goes to families to help them afford quality, affordable childcare. So what we've done is raise the rates, basically, that we pay for childcare. We provide a subsidy to families who are lower and moderate income to help them afford childcare. As you know, childcare is a very expensive endeavor, and we want families to be able to shop for and get the best, highest quality childcare. So we not only have invested in raising the rates, but we also are investing in a quality rating system where we'll pay more if you choose a higher quality childcare center. And what we've done is because so many advocates across the state have helped us appreciate the challenge
Including
we have.
Advocates for Children of New Jersey and our friend Cecilia Zalkind. Go ahead.
That's right. That's right. That we have a challenge particularly in getting infant care, and so we leaned heavily and put that money more heavily into infant care rates. So between January of 2018, when we came in the Murphy administration, and January of this upcoming year, we will have increased the child care subsidy rate for infants by about 40% in this state to try to make it more affordable and accessible for families to get that high quality care.
By the way, if you want to find out more information on Right from the Start, check out our website. Switch gears. Can we talk about the opioid crisis in the state? Again, people say, oh, I guess that's the Department of Health. There's no one state agency that's dealing with the opioid crisis. The Department of Human Services directly involved doing what, and what does that have to do with Narcan?
So two things. We are the state's Medicaid agency, which means we provide health care coverage for 1.7 million folks in our state. About 500,000 of those individuals gain coverage because of the Affordable Care Act's Medicaid expansion. Those, it won't surprise you to know, are the people who have been left behind in health care coverage for a really long time. Single adults with incomes under 138% of poverty. So many of those individuals had substance use disorder challenges. So what we're doing is getting coverage to people. And then what we said in our agency when we came in the Murphy administration was, what are the barriers to people getting opioid use disorder treatment? And one of the big barriers that we had was our own Medicaid program was forcing people to jump through hoops and get prior authorization before they could get medication-assisted treatment. So we got rid of that prior authorization. We're paying providers better to offer that treatment. We are creating support networks so that healthcare providers have resources and know who they can turn to when they have complex cases. So we're really trying to build up an environment that supports medication-assisted treatment, which is what the evidence says works in treating opioid use disorder. But you also mentioned naloxone.
Yeah, there's a free naloxone day. When is that? And by the way, we're taping. That happens to be in June.
It happened in June of this year.
Okay, we're taping in the fall of 2019. Go ahead.
So in June of this year,
will there be another one?
Our goal is to have as many as possible, depending on our resources.
What happens on a day? Sorry for interrupting.
So
by the way, so if you're listening on the audio side, Carole Johnson is in fact the Commissioner of the Department of Human Services in the state. Go ahead.
So we said, everyone in the clinical world knows that naloxone should be in the hands of as many residents in our state as possible. The Surgeon General has said that. Every clinician knows that
What
when
is it?
an overdose is going to happen, when an overdose happens in your community, it used to be a more complicated device. Now it is a simple nasal spray that can be used to reverse an opioid overdose. So everyone should have one. I carry one in my purse. Everyone should be able to access this. So we said, why don't we have a free day where it's available at all pharmacies that can participate, and that individuals don't need to give their name, they don't need to have an individual prescription, and they can come get it for free. We partnered with 174 pharmacies across the state, and 16,000 New Jerseyans showed up and picked up Narcan on that day.
Stay right there. Jackie, our producer, do this. Can you tell everyone, are we putting up the website for the Department of Human Services? Can you say what it is and we'll put it up? Go ahead.
nj.gov/human services.
nj.gov/human services. Can folks find out more about this day?
Absolutely. And then in addition to that, we have just recently also made naloxone free and available to all the staff at homeless shelters across our state. So we're continuing to think about how do we push naloxone out to as many sites as possible so we can save someone and then get them connected to
Commissioner, real
treatment.
quick, by the way, next time you come back, we'll talk about Work First New Jersey. Okay. But I want to do this. On the prevention side of the opioid crisis, what's happening?
So we are investing in community-based organizations to do outreach and education to help people understand what alternative to opioids can look like. You know, there are therapies, there are physical therapy, there are other strategies before you initiate use of an opioid. Now, I understand that some people have been on opioids for a very long time, and so legacy users, that's a different issue than initiating a new opioid prescription at this time when we know how addictive these drugs can be. And so we should think about, and we should ask our physicians and our nurse practitioners about other alternatives.
Carole Johnson has been with us here on State of Affairs. She's the commissioner of one of the largest, maybe the largest. It is the largest department in state government, part of the Governor Murphy's cabinet. She's the commissioner of New Jersey Department of Human Services. They have a huge portfolio. I want to thank you for joining us, and we appreciate your time.
Thank you for having me.
This is State of Affairs. I'm Steve Adubato. We're at NJTV, and we'll be right back right after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of State of Affairs with Steve Adubato has been provided by Holy Name Medical Center, the New Jersey Education Association, New Jersey Sharing Network, New Jersey Resources, MD Advantage Insurance Company of New Jersey, Adler Aphasia Center, and by Wells Fargo. Promotional support provided by New Jersey Monthly and AM 970 The Answer.